Hi there and welcome. My name is Stephanie Trong. I'm a cancer patient advocate diagnosed with non-Hodgkin lymphoma, a blood cancer, a few years ago. And I founded the patient story to help others navigate life after a diagnosis in human terms. We are a patient care partner platform with a mission to humanize cancer, and our hope is to help empower people through our stories and our programs like this one titled How to Dispute Cancer Care Costs. We are so grateful and lucky to have an incredible group of people bringing their perspective to this now, led by Abigail Johnston, a daughter, mother, wife, lawyer, and fierce cancer patient advocate who was diagnosed with stage 4 breast cancer and has dedicated herself to helping so many other people after their own cancer diagnosis. Abigail?
Hello, everyone. And so, without further ado, I want to get to our discussion and to the amazing people that we have today talking about this very human issue, which is getting your cancer care costs covered. And so, Gregory, I'd like to turn over to you. And if you'd like to introduce yourself today, that would be wonderful.
Thank you, Abigail. My name is Gregory Proctor. I'm a 2.5 year multiple myeloma survivor, diagnosed back in July of 2021. And for me, in the early inception stages of being new to this disease, it was very overwhelming and very impactful, not only emotionally, but physically. But one of the things for me at that point in time, coming from a project management background, was trying to figure out how to navigate. And of course, that information is not easily found in a lot of cases, because if you Google things, you tend to get the bad before you get the good. But I think overall for me, the inception of my professional experience, as well as having friends and family, to kind of help me move this forward, has really provided me an overall successful outcome. And today I'm proud to say that I'm still MRD negative and thriving and in remission and continuing to flourish and be an advocate. Can't forget about that.
Monica, would you like to introduce yourself and talk a little bit about Triage Cancer?
Sure. So, my name is Monica Bryant. I'm a cancer rights attorney and co founder and chief operating officer for Triage Cancer, which is a national nonprofit that's dedicated to providing free education on all of the legal and practical issues that can arise after a cancer diagnosis. And we provide that education to the individuals who have been diagnosed, their caregivers, and healthcare professionals who are often on the front lines of getting these questions.
So I, like Monica, am also a lawyer. And in 2017, I was diagnosed with stage 4 metastatic breast cancer. I was 38, and it was, to put it nicely, a bombshell that went off in our lives and has changed everything in the 6 years since that has happened. So I am presently working on getting into a clinical trial, which will be my 6th line of treatment. Breast cancer, a little bit differently than other kinds of cancer, because it is a solid tumor cancer. We don't go into remission. That's not necessarily a status or a goal for us. It is a word that just doesn't necessarily apply to our experience. So we can be no evidence of disease, or in my case, no evidence of active disease. And so I have been able to get to that point at least once in the last 6 years, but back in getting a new treatment, because that is the experience of those of us with metastatic breast cancer. We go from treatment to treatment to treatment. And there are a few that are able to go off treatment for a period of time, but learning to adjust to being a professional patient, I like to call myself, because managing cancer treatments, managing cancer, the experience itself, can be a full-time job. And that's why discussions like this, I think, are so very, very important, because our quality of life, and Gregory alluded to this, is very much tied to not just how the cancer cells are being controlled in our bodies by the medication, but it is also, our quality of life is also so impacted by how we are able to get to that treatment, whether it's literally transportation, getting to that treatment, but also being able to afford cancer treatment. And here in the US, cancer is quite the machine in a lot of ways. There are lots of different players, there's lots of different moving parts. And our goal today is hopefully to illuminate some of those moving parts, at least when it comes to covering the cost of cancer care. And so today we're going to be talking about how Gregory and I have dealt with some of those things. We both have professional degrees and worked in very complicated professional scenarios. And so what Gregory and I have been able to do may not be accessible for every single person, but we're giving you our stories as an example of things that you can do and places to start. But I just want to say that at the outset, if this seems really daunting and intimidating and confusing, it is. It absolutely is. And it is for the professionals that are working in this arena. So I just want to say that at the outset. But getting your insurance contract, whether that's whether you have a government-sponsored insurance policy, whether you're working with the Veterans Administration and have coverage there, whether it's Medicare, there are documents that explain what is covered. Now, when it's private insurance, and that's what I'm going to talk about first because that's been my experience, it is a literal contract between you and the insurance company, and it spells out what they're going to do and not do. So in my experience, there are about 10 pages that are vital for me to know out of all those 300 page long contracts. And I have those pages highlighted and bookmarked and saved and, written all over and all of that, because those are the pages I continually go back to in order to see what are the things that govern, what are the clauses, what's the language that governs what my insurance company is supposed to do. And then I set my expectations based on what my insurance company is supposed to do. And then I know if they have or have not. And I'm going to give you an example, something that I just went through. Many times, a medication, a surgery, a procedure, fill in the blank, something has to be has to have a prior authorization. So the medical professional has to get with the insurance company and say, we want to do X. We want to give this patient this infusion. And the insurance company has a chance to look over that and opine whether or not that is medically necessary. And I won't get started about how that is practicing medicine on the part of the insurance company, but that's the system that we have. And so in my situation, my insurance company has 24 hours to respond to a prior authorization request from my medical team. And that's important for me to know because if there's a delay or if something is happening, I can pick up the phone and call the insurance company and say, hey, my doctor sent you a fax 48 hours ago. You had 24 hours to respond. This needs now to rise to the top, right? This needs to be something that you deal with right away because you've not responded in the timeline that we anticipate. So that's just one example of how knowing what my policy says, knowing who's supposed to do what and when they're supposed to do that helps me not only set my expectations so that I'm not fussing at my doctor's office if it's not their responsibility. I'm not fussing at the insurance company if my doctor hasn't done what they're supposed to do. And then knowing when they have not perhaps done what they're supposed to do, I can bring that to their attention. And that typically means that that will become more of a priority for my insurance company. So things like prior authorization, super important to know. Knowing what tier your medication falls in, because that impacts the cost of your copay. These are just examples of things that it's important to know about your insurance policy so that you know how to navigate that. And Greg, I want to turn it over to you to talk about some examples of what you've encountered in this context.
Well, thanks, Abigail. I think from my standpoint, obviously, I've worked with a lot of attorneys in my professional career, but certainly I'm not one. And, to kind of, I'm going to say a little bit kind of to humanize this, for me, I have always been a professional and working in the environments where, you make your premium payment and you expect that your coverages are going to be there when you need them. And until something traumatic or something like cancer steps and knocks on your door, you don't really realize the implications that you're faced with. And so in my case, the irony of it is we contacted my insurance company. They said, okay, we're gonna be able to kind of help you move and navigate through this, obviously with all of the, the empathy and compassion that they try to give, even though, things are happening. Like you said, it's a monster. It's a machine. So I'm 2.5, maybe almost 3 months into my treatment, unbeknownst to me, because, I'm paying my $1,000 premium. I'm doing everything I need to do, co-pays paid for, all the variations of things that are being handled. But I'm burning $22,500 a week. And the billing department from my oncologist calls and says, Mr. Proctor, we're at a point to where you're $250,000. We're going to have to stop your treatment. Your insurance company hasn't paid. And I'm sitting here kind of flabbergasted saying that I'm trying to fight for my life. I'm several months into my treatment, and you have not received a single dollar from my private healthcare insurance. So at that moment, I realized it wasn't just about the fight of me fighting cancer, but now I've got to kind of re-engage in something that I thought from just a humanizing, aspect of you're paying your premiums, you're not into the divulging aspects of all of the contracts, the legalese, and all of the terms and things that, you would expect would be covered from a humanizing perspective. And at that moment in time, I realized that for me and my family, we had to kind of turn the light switch on, really kind of get laser focused, because now it's not just about the financial implication. It's not just about the insurance and the survival, but we've got to look at all three with kind of the critical eye. And so, like you mentioned before, I had to contact the insurance company and say, I need to see the full contract. I need to understand why you guys are not paying my doctor. Their reason at the time was, we have to go through an audit, Mr. Proctor. You've been healthy. You've never had any type of circumstance like this come along. And then all of a sudden now you go from zero to $22,500 a week. Well, to me, that wasn't an excuse, because I kind of looked at it and said, well, I've never missed a premium. I've never missed a payment. Here it is. I'm needing this to occur. And you mentioned on this, Abigail, as I wrap up with my comment here, is the fact that knowing, as they always say, knowledge is power. And I think in this particular case, having not only the knowledge, but knowing what to do with that knowledge in order to be able to save your life, save you money, and kind of avoid some of those pitfalls is extremely, extremely important. And in most cases, those are just not things that when you're thrown into the tsunami or the wake of cancer that you're thinking about. You're just thinking about, well, how do I get from day to day, from week to week? And so there's a lot more involved, and it all embodies getting yourself educated.
Thank you for all of that, Gregory. And thank you for the comment. So Monica, over to you. What are the top things that patients need to know when they're looking at their insurance contract, or when they're looking at how to get cancer care covered?
Well, I would say that there are some things that people really should understand about their insurance long before there's ever a diagnosis or they're in a serious medical situation. But the unfortunate reality is, in this country, health insurance is confusing. And there are going to be differences depending on the source of that insurance, whether that's through government insurance or through an employer or a policy someone's gone out and purchased on their own. And we know, based on studies that have been done, that only about 4% of Americans understand the 4 most common terms used in health insurance policies. So people don't even understand the words. So we're not even talking about complex legalese here. We're talking about the basic words, because we're never taught what those words mean. And so understanding the basics, that there is an amount someone pays monthly just to have health insurance, and that's their monthly premium. And they're going to pay that amount whether they go to the doctor or not. It's like having car insurance all year but never getting into an accident. But then once someone starts actually utilizing their health care, there's going to be some additional costs, and those costs are going to depend on the policy. Most policies have an annual deductible. That's a fixed dollar amount that someone has to pay before health insurance even kicks in. Someone could have a $500 deductible. Someone could have a $5,000 deductible. It's all going to depend on the plan. Once they've met that deductible, then insurance kicks in and pays a percentage. That percentage is referred to as the cost share or the coinsurance. And here's where it starts to get tricky because we have multiple names for exactly the same thing. Cost share and coinsurance are the same thing. And that's a percentage, right? So it's if someone has an 80-20 plan, once they meet their deductible, insurance kicks in at 80%, but they're still responsible for 20%. And to Gregory's point, when the treatment is expensive, even at 20%, that's still a huge dollar figure potentially. Now, in addition to that percentage, many plans have copayments, which is a fixed dollar amount that again is going to depend on the policy, but it's also potentially going to depend on the service. So someone could have a $25 copayment just to see the doctor, or a $35 copayment to see a specialist, or a $250 copayment to go to the ER. And so even figuring out, okay, what service is this and what's my copayment going to be? What do I have to pay out of pocket right now could be complicated. But even after all of that, I would say the most important thing for every single person to know about their health insurance policy is if there's an out-of-pocket maximum and what is it? Because in theory, that's the most that someone is going to pay out of pocket for their care if they go to in-network providers for the year. And what that understanding allows us to do is figure out, okay, in a worst case scenario, right? Gregory, you were healthy, chugging along, worst case scenario happened, right? Like you get sick. What in a worst case scenario are you going to have to be responsible for out of pocket? And the way you get to your out-of-pocket maximum is going to depend on the plan, but often it involves adding up everything you're paying towards your deductible, towards your co-payments, towards your co-insurance. So it's everything you're paying out of pocket except those monthly premiums. And the reason this is so important, not just once someone's been sick to know, okay, well, how much am I going to have to pay this year? But it's really important on the front end when people are making choices around their health insurance. And we have that opportunity to do that every single year now, thanks to the Affordable Care Act and a whole bunch of other laws that we don't need to get into. But what we want people to understand is in order to be an effective shopper and consumer of health insurance, you have to understand those terms and to be able to do the math with respect to your out-of-pocket maximum.
Yeah, I think that's, for me, that's really key because like I said, for me, I always maintain a pretty healthy lifestyle. And so you start looking at, well, I don't want to have to come up with $15,000, as a deductible. And you start to say, well, if I'm healthy and I still feel pretty good, well, I can go with a little less coverage. You take a little bit more risk. And like you said, having the education and all of the knowledge to be able to successfully navigate that. And I think for me, the older I got, because I was diagnosed at the age of 50, which was not the best year to be diagnosed with multiple myeloma. But at that point in time is where I really began to kind of, like I said, get laser focused on, okay, I've got to change my mindset of thinking, as it relates to my family forward, my insurance, because now I'm at the age of 50 and I'm more susceptible to all of these things that maybe I don't want to think about, but I need to be in a position to ensure that I'm covered holistically without any repercussions.
It is amazing how expensive everything is. And
Yeah.
one of the things about cancer treatment is the medication and prescription drug costs, which can be really complicated. And when you're put on a medication by your doctor and you think, oh, this is going to be the miracle pill that is going to keep me stable, it's going to kill the cancer, etc., they don't always tell you the price tag up front. And in the breast cancer world, many of the medications that we take will cost our insurance companies between $14,000 and $20,000 per month. Some of those numbers that Gregory was talking about too. And in the context of private insurance, there are often copay assistance programs, which oftentimes pharmacists will help patients apply for. These are programs that are offered by the drug manufacturers. So the pharmaceutical companies that develop the drugs will offer these programs. They will also have foundations sometimes. But depending on your insurance, whether it's a private policy, whether it's a government-funded policy, or potentially through the marketplace, these programs apply differently. And so for myself, having a private policy means I am eligible for those copay assistance programs, and those potential copays go from hundreds of dollars a month to zero. Oftentimes, depending too on which tier, talking about language that Monica talked about, the tier of medication, meaning the category of medication you're on, can really affect those copays. My friends who transition to Medicare, whether because of age or because of being on disability, oftentimes are surprised to notice that those copay assistance programs are not always possible when you're on Medicare. And that's where those foundations do come into play as well. But Gregory, how has that affected you in terms of paying for your medication and working with the VA where your primary insurance is?
For me, I had a private healthcare insurance with a national provider when I was first diagnosed. I had been away from the, from the government programs for many, many years since I'd gotten out of the Navy. I hadn't utilized any of their benefits. And so what ended up happening for me is, I started going through this process. And as Monica said, all of this funding that you don't account for start to kind of show up at my doorstep. It's like, that blood work was $16,000. That test was $15,000. This was that. And I was like, whoa, wait a minute here. I mean, what is insurance truly covering if these bills are showing up? And so, of course, after, a couple months of being, embodied and in depth with my treatment, because I couldn't walk, I was very lethargic and kind of, incoherent for 5 days a week for 3.5 months, because I was on chemo for 5 days a week, 6 to 8 hours per day, which was a tough live. I mean, and so for me, once I finally got to a point of kind of reckoning, and really saying it's time to get a hold of this situation, I ended up concluding to the fact that, there are subsidy programs out there, as you've mentioned, copay assistance, drug assistance, and so forth and so on. These things, sometimes they're publicly known, and then other times they're not, particularly if you don't ask the question. And so we started pouring our energy into how could we tap into maybe a $10 or $15 or $20,000 type program to be able to give us a grant and kind of move forward. And I think the other point I want to emphasize as well, Abigail, is the fact that on a private healthcare, there's a little bit of leniency. But by the time I was approved with my government healthcare, being a prior veteran, well, I can't utilize those programs. And so for me, it was a very delicate balancing act as to ensuring that going forward, I was able to reap all of the potential benefits that I could not afford out of my own back pocket to maximize.
But Monica, would you like to talk a little bit more about financial assistance and how patients can go about getting help to cover their portion of these costs?
With respect to getting financial assistance, I would say don't start there. That should not be step one when you see the big bills come in, because there just really isn't a whole lot to go around. And as you both alluded to, there are some barriers depending on the type of insurance that somebody has. So for us, we think that before someone goes down the path of trying to apply for financial assistance, there are some steps to take. So step one is, well, did the insurance company actually cover what they're supposed to cover? And that requires making sure you've waited until you've gotten your explanation of benefits, which is the letter from the health insurance saying, health insurance company saying, like, this is what we're going to cover and this is what you potentially owe. It's about keeping track of your out-of-pocket maximums. So if you've hit your out-of-pocket maximum, they're responsible for paying 100% of it. So I just think there's some, unfortunately, additional steps that fall on the laps of patients and family members, right, before we get to the financial assistance piece. I think, Abigail, you mentioned how expensive your monthly prescription drug is, right? And so it's like, well, how am I going to get money? Like, how am I going to get assistance to pay for that prescription drug? Well, now I'm on Medicare, and so I don't have access to the same pharmaceutical programs that I did. What am I going to do now? Well, are there other places you could potentially get help, right? So could you get mortgage assistance or utility assistance or other types of financial assistance, and then shift the money around. And anything that you had potentially set aside to pay for the mortgage or student loans can get shifted to help pay for prescription drugs. So that would sort of be my second piece. So first piece is make sure insurance is actually paying what they're supposed to pay for. Second piece is don't get tunnel vision. And then third piece is really doing a deep dive into what's out there and what's available. So even among the pharmaceutical companies, there might be different programs. So some companies can provide free drugs. Some companies can provide assistance to pay co-pays. They all have sort of different programs, and even figuring out that is daunting. So at triagecancer.org, we have a chart that lists most of the major cancer drugs and the pharmaceutical companies that make those drugs and the various programs that they have, just to try to make it a little less daunting to go down the Google rabbit hole, right? Because that is stressful by itself. So that's available to anyone who is looking for those types of pharmaceutical assistance programs. And then for someone who's looking for other types of financial assistance, like maybe those utility or the grants that might be out there based on the type of cancer they've been diagnosed with, or sometimes there's even financial assistance for family members who might be acting as caregivers. We have a tool called cancerfinances.org that has pulled a lot of those resources from trusted sources, again, just to try to make it a little easier. Still not easy, but a little easier for people who are trying to seek out those sources of financial support.
But I want to move into talking a little bit more about denials, or when the insurance company is asking for your doctor to jump through some hoops. And so I talked a little bit about, and you're laughing, Gregory, because you know where we're going with this. I talked a little bit earlier about prior authorizations, right? So that's when your doctor's office is saying to your insurance company, here's the treatment plan, we want to do X. So what happens when an insurance company says, no, we don't think that that is medically necessary, or like in Gregory's situation, we need to examine this a little bit more, that sort of thing. So I want to throw out a couple of things that I've learned along the way in dealing, again, with private insurance. So typically, when a doctor asks to do something, asks to get the prior authorization, the insurance company says no, usually you get a letter, you, the insured, you get a letter that says, this is why we denied it. Your doctor typically gets the same letter. And then what? So in my experience, the thing that typically ends up happening next, other than simply changing your mind and doing something different that your insurance company goes along with, is your doctor has the opportunity to do something called a peer-to-peer discussion. And this is covered for in all the insurance contracts that I have seen, along with the definition of what a peer is. And so this is what happened to me very early on in my cancer treatment. My doctor wanted to do a PET scan. For those of us with solid tumor cancers, PET scans are oftentimes the gold standard in terms of seeing where the cancer is, how metabolically active it is, right? So this is something that a tool that the doctors need in order to be able to make good decisions. A doctor employed by my insurance company, who was a family doctor about 5 years out of medical school, deemed the PET scan not medically necessary. And so I learned by looking at my insurance policy that my insurance company was required, upon my asking, to provide a peer to my doctor. And so I realized, wait a second, somebody who's 5 years out of medical school, that's something significant that they did, obviously, but somebody who has a small amount of experience and is in a specialty that has nothing to do with oncology, that did not meet the definition of a peer in my mind, or by the definition in my insurance policy. And so I learned that I, as a consumer, could say to my insurance company, I require you to provide a peer to talk to my doctor. And let me tell you, that conversation took 5 minutes. The first conversation where it was denied, my doctor spent 40 minutes trying to convince this doctor employed by the insurance company that what she was doing was standard of care. What she was doing was what happens in these circumstances. When she was able to talk to an oncologist, not an oncologist that had 30 plus years of experience, mind you, but somebody in the cancer world, it was a 5-minute conversation and it was approved. The first person that my doctor was talking to was literally looking at a chart and looking at the wrong category. She was looking at somebody who is stage 3 versus stage 4, didn't understand or didn't appreciate those differences. And so that's one thing that I've learned along the way, that I, as a consumer, can say to my insurance company, you need to provide a peer to talk to my doctor. And I've let my doctor's offices know, and their staff, as they are scheduling, they can also say, our insured, our patient, they are able to ask for a peer, and we want to make sure it's a peer that's talking to your doctor. So that's one small thing. By looking at your insurance policy, understanding that definition of what a peer actually is, that can enable your doctor to save time, right? Because that 40-minute conversation took my doctor away from seeing patients. The 5-minute conversation was obviously a whole lot more effective and efficient. And it's a really heavy lift when it comes to you as a person attempting to explain to your insurance company why they are not following the contract. It's possible, but that can be a heavy lift. So Gregory, what experiences have you had in getting something covered, especially when you got that initial, no, we're not going to cover that?
Well, I think one thing that really stands out to me as it relates to appeals and denials was just the notion of, after burning $22,500 a week and hitting, a cap of, I don't know, $250,000 with my doctor. And of course, I don't know what the number was with my insurance company at that point in time. But as that continued to, move forward through my treatment and trying to, get the insurance company to pay, and understand, as I'm coming out of what I consider to be my treatment and getting prepared to go into my stem cell transplant, trying to preface the discussion with my insurance company as to what would they cover. Now, at this time, I've got policy, I've got documentation, I've got this, I've got that. And for me, just hearing the words, we will cover this, but we won't cover that. And in layman's terms, for me, what that meant was, okay, we'll cover you for the period of your transplant. However, if there's any complications, then that's kind of on you, Mr. Proctor, which is kind of how I perceived, the overall letter that I received. And so going from my commercial, or should I say private healthcare, trying to get the VA government insurance to pick me up, I had already been denied by the VA. So it was very frustrating very early on, knowing that I wanted to go through the VA from the beginning, but I was denied. And that's just kind of how the system works, in the beginning of, trying to prove your case. And for me, their reasoning or rationale is there was no service related tie that could indicatively tie back to you being diagnosed with cancer. And so I had to get attorneys involved and go through all of this legality and justify what my job and MOS was in the military, and all the different variations of things that I worked around. And even going through that, still took a tremendous amount of time. It wasn't like, yes, we're going to approve you. So for me, one of the things that I had to kind of really, sink into, which I've been able to do throughout this whole journey, is don't ever give up. And so find a way to kind of navigate. And so what I'm going to say here very, very quickly or briefly is how I kind of navigated to go from one essence of knowing that my coverage wouldn't fully cover me on a private side, to being able to have 100% complete autonomy of coverage on the government side, was establishing the appointment, going back through all of the blood work and all of the horrific tests that I didn't like, bone marrow biopsies and all these different variations of things, again, to kind of prove out through their own bureaucracy that, hey, this guy has multiple myeloma. And once we went through and proved all that out, for the second time, which it had already been validated, then at that point I was able to get 100% coverage. But that took approximately 5 months from the time that I was diagnosed up until I'm getting ready to go into a stem cell transplant. And the best Christmas gift that my wife and I could have ever received in December of 2021 was that letter from the VA saying that we are now your primary healthcare provider, and we will cover not only your stem cell transplant, but all of your post-maintenance costs. And we're talking hallelujah. I mean, that was like well worth all of the effort, the headache, the anxiety, the concerns and worries to get to that point of knowing that finally the system works. But like I said, you can't ever give up. You have to continue to push not necessarily your narrative, but your narrative of survivalship.
Thank you for those reminders. And I think it's easy to give up, especially when there are a lot of roadblocks. But I love how you mentioned how you realized that you needed help, and you realized that getting a professional involved was important. So Monica, would you talk a little bit about the legal rights that we each have as consumers, and talk about those appeals and what services might be available to patients?
Well, I think Gregory did a little bit of my job for me in that we don't have to take no for an answer. I mean, it boils down to the idea that we don't have to take no for an answer. Now, the details around that will certainly depend on the type of insurance we're talking about, whether it's VA or TRICARE or Medicare or Medicaid. But if we're just talking about private insurance, so that's insurance someone either gets through a job or one that they've gone out and purchased themselves. At a bare minimum, every single consumer is entitled to at least 2 levels of appeal. The first level is an internal appeal, and that's essentially where we're going back to the insurance company and saying, no, we'd like you to reconsider. Now, that internal appeal can take a couple different forms. It could be a written internal appeal where you're providing documentation in writing, test results. It could also be what you were just referring to, Abigail, which is that peer-to-peer. So a conversation that 2 healthcare providers are having. That is just another version of an internal appeal. And there are time limitations on that. So there's time limitations on when we as consumers get to file those internal appeals. We get 180 days. And then there's time limitations on the insurance company to give us a response. Depending on where somebody is. So in Abigail's example, it was a denial of a prior authorization, it sounded like. So the insurance company has to give an answer within 30 days. If you've already received the service and they've come back and been like, nope, we're not covering that, then they get 45 days. But here's the problem. When we're talking about cancer care specifically, a lot of times we don't have 30 or 45 days to deal with getting an answer. So what we as consumers need to understand is that we have the right to ask for an expedited appeal when the need for care is urgent, which in most cases, when we're talking about cancer care, right, the need is urgent. Then the insurance company has to give an answer within 72 hours. But people don't know this. People don't understand that they have this right. And if the insurance company ultimately comes back and still says, no, we're not going to cover that, whether that's after a peer-to-peer or after a written appeal, then we have the right to something called an external appeal. And that's where we go to an independent entity, and it's going to vary state to state, but it's an independent entity that's going to look at all the facts, it's going to look at all the medical evidence, and then it's going to make a decision as to whether or not the care is medically necessary. And you've thrown that out a few times, Abigail, but I think it's important for people to understand those words are the legal standard on which the appeals are going to be decided. Is it medically necessary for you to get that service? And the decision of the independent entity at these external appeals is in fact binding on the insurance company. Now, I made it overly simplistic for the purposes of this session, right? I understand that that requires a lot of legwork and effort to get the doctors involved. I'm not minimizing any of that. But here's what we know to be true. Of the millions of claims that are denied every single year, 99.9% of them are never appealed. Let's say that again. 99.9% of the denied claims are never appealed. Yet, we also know that when people do appeal, somewhere between 40 and 60% of the time, it's decided in favor of the patient. So when we're talking about how can we help people afford cancer care, appeals is the conversation I want to have with people long before we get to financial assistance. Because if insurance is coming back and saying, we're not going to cover that for whatever reason, you've hit your max, we think you're too expensive, we don't think you need your PET scan. If people aren't appealing those denials, they're essentially leaving money on the table.
That is such a great point. And I think it is really important to say, too, that when your insurance company knows that you will appeal, that you will not just take their decision lying down. In my experience, they're much less likely to deny things in the future. And so I tell people all the time, it's really important to make it hurt and make it difficult for them. And I'm not talking about doing anything drastic, meaning just take up a lot of their time and be bold in saying what you need and in filing those appeals. Because in my experience, typically they won't be as likely to deny something in the future. But thank you for giving us those numbers, Monica, because those are shocking numbers, kind of like the millions of dollars that Gregory and I were talking about earlier. Well, I want to move into talking overtly about financial toxicity, right? We've thrown around that word a couple of times as we've been talking. And I didn't realize this, but in 2013, it was researchers at Duke University that coined the term financial toxicity to describe the financial hardship and distress that can result from the high cost of cancer treatment. So their research showed how the burdensome out-of-pocket expenses associated with cancer care, such as copays, deductibles that we've talked about, can negatively impact patients' mental health and quality of life, leading to increased anxiety, stress, and depression. So we hear all the time, right, that stress is not good for patients. Stress is not good because it changes chemical things in your body. It actually makes your quality of life more difficult when you are stressed out. And then here comes our medical system and causes that stress on us. So, Gregory, how have you handled the mental toll of those bills and the financial stress and all these details that we've been talking about? How do you handle that mentally and emotionally too?
Well, I think one of the things, as I mentioned earlier in a prior segment that we were talking about, you've got to be willing to accept that this is your reality. And, that's the first step, in going forward for me with any type of traumatic or life altering, things that are happening. And I think the other aspect that became very, very important for me personally was stepping away from the notion of dealing with cancer 24 hours a day, 7 days a week. And so one of the most therapeutic things that I did during my cancer battle was getting out in nature and walking on the trails and just kind of separating my mind from the overall objective of having to have this wreak havoc on me. Because at one point in time in my life, just to kind of wrap this up through my cancer journey, is I was questioning whether or not, with all of the debt and bills and things coming in, and plus your life still goes on. So you still have your normal expenses, and now you've got cancer expenses and all these other things that happen, was questioning, well, will I be able to afford groceries this week? And that's when you really know the toxicity has really gotten hold of you, and you've got to kind of navigate and weather the storm to figure out how to maneuver to move things forward. And of course, I've done a lot of things which we don't have time to talk about right now to kind of get through that process and find assets and various other elements in my life that I could actually move forward with, not having so much of the burden of the debt, kind of wreak havoc on me.
Thank you for sharing that, because I tell my medical teams all the time, I have to fit cancer care into my life not fit my life into cancer care. And that it's a paradigm, right? Or just a different way of looking at things that I think makes us as patients maybe address some of these things a little bit differently. But Monica, would you talk a little bit about what resources that Triage Cancer has, or strategies for managing those medical bills and the financial things so that people can have a good quality of life?
Yeah, so we really are, when you look at triagecancer.org, you will see a variety of topics around health insurance and employment and disability insurance to really try to address holistically the financial impact that cancer and cancer care can have on people. But I'd say that when really thinking around how to maximize health insurance, I think that it is important for people to remember a couple of things. First, we have the opportunity every single year to make choices. And I've said that earlier, that if someone is experiencing high out-of-pocket expenses due to their insurance this year, there may be opportunities for them to pick a different source of insurance for the coming year. So open enrollment for the health insurance marketplaces is coming up at the end of the year. Open enrollment for Medicare is coming up at the end of the year. And that's an opportunity to make some different choices, whether that's finding a plan with a lower out-of-pocket maximum, or that has more of your providers in their network, so they're being covered at a higher rate, or has a different prescription drug formulary, so any prescription drugs you're taking may be covered at a better rate. And so I think that that's really key, is to remember that yes, you may be experiencing high financial toxicity right now based on the type of insurance you have, but there may be opportunities to make those changes for the coming year.
100%. Absolutely. All right, let's move into a topic which I personally get a little bit itchy about, which is this whole idea of empowerment. And this word gets thrown around a lot, right? And I think that it's important for us to understand personally how we're looking at empowerment, because there are multiple definitions of empowerment. One definition, the one that makes me itchy, is that somebody is giving you power. You're getting power from someone. The secondary definition, which doesn't make me as itchy, is this idea that we all have inherent power, right? We have power as people, we have power as patients. And as we're navigating this system, how we interpret or how we embody the power that we actually have, or that maybe we want, can make a really big difference in navigating cancer treatment. So Gregory, how do you look at empowerment? Maybe how have you found that, or how have you gotten in touch with your power as an individual and as a patient?
Well, I'm going to be brief. Certainly for me, when I was diagnosed, in a lot of cases, people, they tend to segue into what I'm about to say. Sometimes they don't. I realized the importance of my purpose in life to live, and also realized the importance of my purpose to rekindle my faith with Lord Jesus Christ. And so for me, my empowerment came back through not only my connectivity back to my spirituality, but also through my family, friends, and support, from, the congregation of people that follow me on social media was really there to kind of lift me up. And so the way I took that empowerment was to try to be a beacon of hope, to try to be an inspiration, to try to be a point of uplifting people's, minds and souls when they go through such a horrific experience, to let them know that, number one, you're not in this alone. And number two, that there is unconditional love out there, even if you get that unconditional love from a stranger that gives you power and uplifting you to be able to kind of weather the storm and be able to move forward.
Thank you for that, Gregory. That was beautiful. Monica, would you like to chime in on this whole idea of empowerment and how that kind of fits in with what Triage Cancer does?
I think the only thing I would say is I agree with you, Abigail, right? Like, it is not my job as a cancer rights attorney to give somebody else power, because that power is theirs. But what I can hopefully give people is knowledge that they need. And as we have discussed, knowledge is power. And so certainly I think that where I feel my place is in this conversation is that you shouldn't have to have a law degree or a project management background or a million people surrounding you and lifting you up to be able to survive this disease with your homes intact and your jobs intact and your insurance and overall financial health. And yet, unfortunately, because of our system, sometimes that is what's needed. And so really what I think is that we want to walk side by side people and support them through education and providing information so that they then can take that and use their power.
Yeah, that's very, very powerful. I guess the only other point that I would add that I didn't get in my prior dialogue there is, as we talk about education, you need to kind of seek others that have endured, and weathered the same storm that you've gone through. And a lot of times people say, well, that may not be a good idea, or maybe that is a good idea. But for me, that became, kind of one of the circumstances that my wife and I was able to glean from others that are 5-year survivors, 10-year survivors, 20-year survivors, and understanding how did they make it that far. And of course, now drugs and everything have changed, but in the essence of just knowing how they weathered the storm became a tremendous, valuable lesson for us.
That's a wonderful topic or a comment to Gregory, just this idea of seeing examples of other people, which is what we're doing today and what the patient story does all the time as well. So I've jotted a few notes just as far as kind of the key messages from our discussion today. And I just want to run through those and then we'll finish up. But the first one is to know who you are and allow your strategies and allow how you do this whole figuring out how to pay for cancer flow from who you are. If you're doing something that's not really you, it's not going to work so well. So know who you are. The second that we've mentioned multiple times, knowledge is power, right? Knowing how to navigate things, knowing the right things, and sticking to your guns in that context can be extremely helpful. Gregory talked about this quite a few things. Don't take no for an answer. Keep going. Keep pushing. Keep asking questions. Not forgetting who to ask for help. I'm sorry, don't forget to ask for help and collect those people who you can ask. So, making sure that you're saving the link to Triage Cancer, which is triagecancer.org, right, Monica? Okay, right. Watching for other patients who are navigating this sort of thing, jotting their name down and knowing that you might be able to reach out to those people for help. Social workers, I think, can be on that list. Nurse navigators can be on that list. People who are professionals and do the kinds of things all day long that you're trying to do could also be a great resource. And then my last takeaway from all of our discussions here is vote with your feet. Vote with your feet when your insurance policy doesn't cover what you need. Vote with your feet if your doctor is not going to bat for you and doing that peer-to-peer. Vote with your feet if, medication is something that is just way too costly and maybe there's an alternative. So we have these choices, and to vote with our feet in those categories can be extremely helpful and maintain that quality of life to fit in cancer care into our lives versus the other way around.
Thank you so much to Abigail, to Gregory, as well as Monica, who's with Triage, for a wonderful discussion. And we hope that you walk away feeling like you at least have one key point you know a little bit better to help you and or your loved one through what can be a very difficult but much less talked about part of cancer care, the costs, and for some people, what we'd call financial toxicity. So we want to know if this was helpful for you. So please take a couple of minutes to share your feedback in our survey that will pop up just now when this box closes. And there will also be a link in a follow-up email. It's also an opportunity for you to let us know what you want to hear about more that would be the most helpful for you. So on that note, we hope to see you very soon at a future program. I'm Stephanie Trong with The Patient Story. Take good care.